And, you know, you work so hard, medical school to residency to getting your career going. And you kind of just got your head down. You've got a track to follow. You're not doing anything that other people haven't done. You can just kind of get into that groove and go and just work hard doing it. But I got to the point in my career where I kind of pick my head up and look around, and it's kind of like, all right, well, what is going on right now? And I was kind of unsatisfied with some of the work I was doing. I was kind of frustrated with the business of medicine, which unfortunately is life. Got to earn money and pay off loans and raise a child and all those things. And so there's just kind of this point in life where it's like, man, I've done everything right. But I'm not feeling content. And I had checked all my boxes. Been doing jujitsu. I was good at it. I had a family. I had a career. I was doing the job I liked doing. I couldn't imagine doing something else. But then things started falling apart. You're unsatisfied. You're kind of like, all right, well, what did I do wrong? Perhaps it's not that I did something wrong. It's just I've been, thinking about things in the wrong way.
Hey guys, how's it going? My name is Caleb. I'm a medical student between his third and fourth year of medical school, doing a research year, and I'm just sitting down and having conversations with interesting people that are kind enough to help me out along the way. It's only through podcasts and interesting conversations like the one we're going to have today that I've been able to navigate this journey. I'm a first generation student just trying to figure it out the best I can. So I wanted to pass along some of this knowledge to you guys because it truly is more than medicine. You wouldn't believe the different paths to success that people have found. So hopefully you guys get something out of this. Today's guest is Dr. Lucius Pomerantz. He is an orthopedic hand surgeon out of San Diego, where he was born and raised. He's passionate about a lot of different things like philosophy, Brazilian Jiu-Jitsu, and which has led him to be able to do UFC fights, being the ringside physician. Just a super awesome guy, and I really, really appreciate him taking the time to sit down with a nerd like me and pick his brain about how he got into med school, the mindset that set him up for success, ultimately getting into orthopedic residency. But he'll be the first to tell you it was probably a wrestling match that he had out in front of the school that got him into that residency position. And so we talk about that. We also talk about how he has been able to go toe-to-toe with a former Navy SEAL by the name of Jocko Willink. You guys might know him. I don't know. But we don't really touch on that as much as we talk about his mindset, his journey, and what set him up for success. I'm recording this in my car this morning because at the end of the day, guys, I'll be honest with you, I don't really feel like sitting in front of a camera and being like, hey guys, welcome to podcast, So I just want to go ahead and get it out of the way this morning. A little unconventional, I know, but let's stop yapping and let's get to the podcast, all right? Enjoy.
All righty. Dr. Pomerantz, how's it going, sir?
It's great to be here. All's good, man.
Sweet. Well, everybody, all 5 of you listening, this is the Walmart brand of the Joe Rogan experience. Ironically, we will be talking about jiu-jitsu at some point today, so it's kind of relevant, I think.
Yeah.
Maybe you can convert me over into, what did you say, chess with the human body?
Yeah, kinetic chess, human body. Everyone's got the same pieces, and it's just how well you use it.
It's insane to me what you guys can do, but we'll get into that. So for everybody listening, Dr. Pomerantz, hand surgeon out in San Diego. I flagged him down as a fanboy when I was in San Diego in March this past year at a conference, and I was in line trying to get some free swag. I don't think I got my t-shirt's a little too big. We were on the tail end of all the good stuff.
Yeah. They only had the big sizes left. Yeah.
Right. And then flashing going backwards, I was into hand surgery. I was thinking I want to be a hand surgeon early on, and my buddy sent me your account, Dr. Pomerantz, and he said, I think you'd really like this guy. He seems really cool. It's like, cool. So I started following him. I think you followed me back. And I think I told my mom. I was like, Mom, a celebrity just followed me. This is so cool.
I'm definitely no celebrity by most standards, but it was cool to be recognized. And I mean, I haven't quite figured out what my audience is, but I would hope that medical students can kind of see what I'm doing and see that, yes, being a doctor is part of it, but there's a lot to what that could be, as far as education through social media, patient advocacy. There's a lot of different things you can do. And with the internet, you can extend that reach pretty darn far. So yeah,
Yeah,
it was,
it's a small world because I'm in line and then this guy walks past me and I'm like, that guy's got a good head of hair. Oh, I know I recognize I don't know him, but I recognize him. Okay. Do I lose my spot in line? Yes. Yes, just go. And so I think I lost my spot in line and we talked for a few minutes and I was sitting there like, "Oh my gosh, please, like I'm so sorry to take up your time. I know you're busy." But you had a podcast to go do right after that with New York, the University of New
y-
York, right?
yeah, NYU, and I had made some friends recently doing a separate conference, combat sports medicine stuff, and they were going to do some more talking about that kind of topic and invited me to be on. And yeah, that's, and well, I'm sure we can talk about it more, but no matter how hard you work in medical school and the test scores you got and the resume boxes you've checked and the research you've done, connections and meeting people and doing well by other people is really going to get you far more so than a lot of the other stuff that we prioritize in medical school.
Yes, sir. Because I'm on my research year right now at the University of South Carolina in orthopedics, and that all came to be because I reached out to people for help, and that's what I talked about in the very first episode of this podcast with my mentor. We talk to first generation students, and we tell them like always reach out and ask for help. Never be afraid to ask for help. Um, so would you echo that same belief? Like, or should people be nervous to reach out to this, Instagram hand surgeon, combat
Yeah.
sports guy for help and
Well,
advice in life?
clearly it's worked out for you and your interactions with me. And I don't think I'm exceptional in any way. I think one of the reasons why a lot of us go into medicine is to be an educator and to be a mentor. And we understand, my growth through this process. I've been standing on the shoulders of giants. And while I'm certainly not a giant myself, if I can be a launching point or a resource or something for someone else who, whether it's inspiration or just advice or whatever, that's what we're here for, not just the doctoring. Um, so I would definitely advise anybody and everybody to reach out. The worst case scenario is the other guy's just really busy and isn't going to be able to do what would have been great. But I would say the vast majority of the doctors that are out there, if you reach out, they're going to try, at least put you in touch with someone that can help you, at least give you a few moments for advice. And then you never know, because 3 years later, when you're applying for something, they write you a letter, or at least they make that phone call and go, "Hey man, this guy reached out to me. He showed being proactive. I got to know him and seems like a good guy. I think he would fit your program well." That kind of stuff. That's how it all
Right,
starts, is reaching out.
right.
If you don't reach out, it won't happen. It's impossible for it to happen. So yeah, it was something I wish I knew better in medical school. I kept to myself. I've worked hard. I got the good board scores, but
Mhm.
it would have been a lot easier had I paved the way with calling people or meeting people outside of the medical school I was in. So
See, yeah, so that's interesting. And so we'll have to tie all of this together and to just go ahead and get a jumping off point established. Something you said earlier about there's so much more to medicine than just being a clinician. That's the name of this podcast, right? It's not a big name yet. Okay, it's got a cool logo. It's pretty creative. It's got the more sign next to
half the battle,
medicine,
man.
more than medicine. And I was like, some other guy had it, took it and hasn't posted in like a couple of years. I was like, I'm just gonna snag it. Why not? So this whole conversation is kind of about more than medicine. And so what I like to do is let's hop in the time machine and let's try to go back to your early life. Let's go super early, growing up. And
Yeah,
what were your parents like? Were you brothers, sisters,
sure.
all that stuff?
Growing up in coastal California, Santa Cruz, California, kind of a little beach town with UC Santa Cruz, the banana slugs. Um, I half jokingly, but it's very kind of true. My parents were kind of hippies who went to UC Santa Cruz and were involved in political activism and met doing that kind of stuff. And so within that environment, they raised four kids. I'm the oldest of four.
Okay.
My dad was a firefighter, and my mom was initially, when I was initially growing up, was on the city council of Santa Cruz and was mayor of Santa Cruz at one point.
No kidding.
And then when the third came, the third sibling, um, my youngest brother came along, it
Yeah.
was kind of like, well, it's a lot to do. Like, so she kind of retired from political life and became a house mom, but was still doing all kinds of other stuff. Um, yeah, growing up, sports were really important to me, but I was kind of small. I was one of those late bloomers. I
Okay.
was,
So
I
what was your sport?
so did the traditional stuff, baseball, soccer, too small for football. I tried it summer of freshman year of high school and I was just way too small.
Dude, hey, listen, man.
Yeah,
Go ahead. Go ahead. Go ahead.
I was the smallest boy in eighth grade. Um,
Mm,
they let us line up for graduation by height, and I was the first one. So I was tiny. Broke 5 feet tall as a freshman in high school.
let's go. You
Um,
made
I was just a late bloomer. I knew
right.
eventually I was going
Right.
to grow, but it just didn't happen until towards the end of high school and into college. Um,
Right.
but I worked hard in sports. I had, some natural ability to play. I
Hmm.
wasn't gifted by any means. I could understand how to make the games work and be on the field in the right place and, those kinds of things. But when it came to straight sprinting or that kind of stuff, there's going to be people who are bigger, faster, stronger than me. But I found wrestling, weight classes.
Yes. Here we go. You're like, you guys, we can cook with this. Let's go.
Yeah. So I was like, all right, weight classes, this is helpful. Even then, as a freshman in high school, weighing 83 pounds, and the smallest weight class for varsity was 103 pounds.
Right.
It was it was still difficult until finally junior year. I had to cut weight to make that lowest weight class.
Deal.
But wrestling was certainly formative to me. It was the first time that I decided, all right, I'm going to lock in and work hard at a sport, and then that made me learn about finding an angle somewhere. I clearly wasn't going to be bigger or faster than guys, but I could maybe learn about nutrition or exercise physiology or things like that. And on my own, there I am in the library trying to
And were
learn
your
about.
yeah, and were your parents like super sporty themselves, or did you kind of have to be your own guide in a sense?
So my dad, played traditional sports growing up, but it wasn't like he was a college athlete or anything like that. And my parents, to their credit, never pushed anything on me. Um, is kind of their thing was like, as long as you're happy, we'll be happy. And so I joke that my way of rebelling against that was to be a super jockey dork, like studying all the time and just regimented, organized. Um, uh, and that was kind of where I was at. Um, and then being one of four kids and we're kind of scattered all over the place. I was kind of on my own sometimes where, all right, I'm riding my bike to junior lifeguards and then to soccer practice and then to jujitsu and then home. And I would have been gone, from 8 in the morning till 8 o'clock at night, sometimes just doing my thing, working out. Uh,
That's
uh,
awesome, and we're very similar because that was kind of I was kind of all gas, no brakes in high school. I tried to play every single sport that a small, skinny person could play, right? Because I when I was back in middle school, I tried out for the team, and they said they lined up the dummies, and they said, all right, everybody's going to line up and take turns. I don't know why they wanted to watch us tackle these dummies out on a dirt field to see what we're made of. But the dummy tackled
Football.
me. Like it rolled on top of me. And I was like, I just got up and I acted like it didn't happen. Everybody saw it. Everybody knew what just like the dummy just tackled that kid. Needless to say, I found running, I found soccer, swimming. I'm long and lanky. I may
Okay.
have more fans. I don't know. Um, but I tried to load all those up so that I could like not study as hard because I didn't have a goal either. My family knew I should go to college, but I didn't know what it would take. And so I stayed out of the house. I went to like 2 soccer practices, and I would run cross country before soccer practice, then next season swimming, then next season soccer. And during the summertime, I was just working and yeah, always staying busy.
You know, I, sports was just so important, I think. Um, the team sports, you learn how to work with other people, learn to work as a team for a bigger purpose, which a lot of people don't figure out even in as we're adults and in as surgeons. Well, all right, we're the captain of the team or whatever, however you want to see it. We're still working with a team. And if you're yelling or berating people or not helping them do their jobs, it's just not going to work as well. So team sports, fundamental to becoming better, interacting with people as we get along. And then even the individual sports, running, man, what better training than when you have to be stuck in the library studying all the time and you just got to be alone with your own thoughts, doing something you don't really enjoy at that moment, but you have
Right.
to keep going. I was an okay
Masochism.
runner. Yeah, but it's just kind of just being able to sit with yourself,
hmm
stay focused on the task at hand, and get it done. So just, yeah, important things, important skills to have to get through all the hoops that we have to get through as medical students, and then through residency, and then out in practice as a doctor. You're still doing things you don't necessarily really want to do, and you kind of sometimes feel alone doing it, but it's the obligation, and being able to stick with it and stay on it, even though you're not really enjoying the process at that moment, is
Yeah.
also very important.
Yeah, I always felt a little bit jealous and I would, kind of scoff a little bit watching these D1 athletes get the orthopedic residencies and I'm like, "Oh, it's because they were a D1 athlete. That's why." It's like, well, they've had to sustain a team mindset all the way up until the point they graduated their undergrad. And so it makes sense that a residency program that is very much a team sport, especially orthopedics, is like, yes, please come here. Like we know you understand hierarchy and all that stuff. Um,
Yeah, totally. As you're saying, that the certainly orthopedic surgery, a lot of former athletes are in it, and part of that is the appeal of maybe you're doing some sports medicine, but there is a certain camaraderie that is built when you are very busy. It's by no means a easy specialty to go into. There is always more work to be done. It's hard, and if you learn to work as a team with your co-residents, it's so much better than if you're not doing things as a team. There's guys the guys who don't make it, or gals, the people who don't make it are the ones who can't work with the team.
got you. Well, that's a good point right there. But tell me kind of, so you're doing the wrestling in the high school. You found your niche and you're heading into college. Are you in doctor mindset yet, or are you still trying to figure it out? Because your parents didn't push you anywhere,
No. I mean, the expectation was college, certainly,
of course.
and it was an idea in the back of my mind. Probably those times learning exercise physiology and nutrition in the library. I'm like, okay, like human physiology interests me. This is kind of cool. And then with my dad being a firefighter and my mom on the city council, there's kind of an altruism to my
Yes.
upbringing, thinking of a bigger community and wanting to contribute to that community. And so, yeah, certainly the combination of science and the way the body works and sense of community was pushing me towards the thought of being a doctor. I had it in my head, but I didn't know if I could do it. Sure, I'd done well in high school, but I didn't think of myself as all that smart. And so it's kind of like, well, all right, well, we'll see. I'll do the pre-med classes and keep the door open, but I don't know. We'll see.
Okay,
And
was there a switch that flipped at some point? I was a late bloomer when it came to medicine. It was
yeah,
halfway through for me.
it was always an idea. And so I
Okay.
figured, well, if I aim for it and miss, at least no doors will be shut. So I was doing the pre-med classes, and a lot of so I went to UC San Diego as an undergraduate, and the college, they have these separate colleges, and the college that I was part of, a lot of their prerequisites, the things you had to do just to get a degree from that college, was a pre-med track.
Right.
That wasn't because I had a plan. That was just okay. There we go. That's what we're doing. And it was, I think, sophomore year of college where I did well in organic chemistry. That for whatever reason was a class that filtered a lot of people out.
I had the same experience.
Okay.
Yeah, because I struggled with Bio 101, like just having to memorize and regurgitate all this information. It wasn't physiology at that point, as I'm sure you know. So it was like diversity, evolution, DNA. I was like,
Mm-hmm.
but when I got into like chemistry, I tutored chemistry. I was like, I like this. I'm gonna switch gears and do chemistry, and then
Okay.
organic chemistry. This just clicks. 99s, 97s. I was like, oh, this is fun. This is fun
Okay.
for me. Like this is not even a thing. So I'm guessing
I
so you had the same experience.
Well, in a way, I liked organic chemistry more than the general chemistry because I could mess with the little models and picture it and move things around and that kind of stuff. And so
Like Tony
that kind of
Stark.
clicked.
Yeah.
That clicked in with me a little bit better. But I was definitely not getting 99s, but no one in the class was. Like I remember one time, I think I got like a 48% and it was the second highest score in the class. I mean, this was just one of those
I'm sure
classes
you
that
guys are more
just,
rigorous though over there at UC San Diego. I'm talking about a small commuter school in Georgia.
yeah. Well,
So,
whatever was happening, it was a class
mhm,
that definitely chased away a lot of pre-med people, but probably because for the first time in your life, you're scoring less than 50%, but it's graded on a curve. And so, uh,
right.
yeah, so I did well enough. I got good scores and I was like, okay, I think medicine is something I could do. Uh, I started kind of looking around and I needed to get a job to earn money. And so I found a job in medicine that was certainly not its most glamorous. It was as a GI tech, where
Okay.
I was cleaning endoscopes and yeah, yeah,
All right. That's a new one. That's a new one.
and it was in the world of medicine. I was around doctors. I didn't know what kind of medicine I wanted to go into, but I was around doctors, and at least as a way of earning money because I needed to earn money. Um, but I got to kind of see a little bit of how medicine worked in application at that point.
Right.
And the doctors I worked with were great, but it was funny. One of them, when he was writing me my letter of recommendations, like, you're going to be an orthopedic surgeon.
What
And I
made
was
him say
like,
that, you think?
I was a jock and a meathead, probably. He's like, yeah, you're right. If you're going to go to medical school, you're going to be an orthopedic surgeon. And,
That's
and
awesome.
I didn't know what that is. I mean, I'm like, okay, right. Surgery, probably not. That's not for me, I don't think. I think emergency medicine is what I want to do. That's just kind of the idea that I had.
Yeah.
And that was partly because I liked the idea of kind of knowing about a lot of different systems, and working in an emergency adrenaline situation kind of appealed to me. And of course, if we go into medical school and start experiencing the application of emergency medicine, it's usually a little different than that. But
Hmm.
That was my plan as I started getting towards the end of college. And all right, take the MCAT, did okay, good enough to get into medical school, and yeah, just worked in that direction.
Okay, so did you struggle with the MCAT at all?
I only took it once, and
Okay,
in hindsight, I probably could have done better, but it was a good enough score. It was a good enough
right.
score to get into medical school, and so I was like, all right, good, cool, great.
Sweet.
Um,
And you stayed around. You got in local, it sounds like, right?
well, my thing was I was waitlisted like at
Mm,
all the schools I really wanted to go to. The UCs, including UC San Diego, they waitlisted me. So I was waitlisted at a lot of these places I really want to go to, and I got into a few other places, and one of them was Albany Medical College in upstate New York.
heck yeah.
And it was kind of close to some family. I had family in New Hampshire, and I was like, well, all right, this will be new, it'll be different. Got family within a couple hours, like, all right, this will be fine. And off to upstate New York from coastal California I went.
How has that changed for you?
It was different.
Okay.
In California, you get very spoiled. In San Diego, I don't think I still don't own an umbrella. So if it does rain, it
That's
catches you off
awesome.
guard. But
Right.
fortunately, it's very rare. And the temperature is usually below 60 and 80,
Hmm.
whatever the season. And yeah, okay, that's life.
Right.
Upstate New York is a little different. There's kind of 10 months of the year where you're kind of miserable one way or another. It's either too hot and humid or freezing. And so that was a different thing, but perhaps it helped me study. It was that much easier to stay in the library and go, no, I'm good. I'll be inside just reading away.
Right. So transitioning to medical school, um, did you have any kind of wake up moment where all the habits you had, because it sounds like similar to me, high school wasn't really a challenge. Like college was a challenge for a second, and then I adapted to that pretty well. But medical school for me was enormous adjustment. So talk about that adjustment for me. Kind of
Yeah,
what shaped that mindset for you.
it was an adjustment. I remember, that first day of lectures, and people would immediately run off to the library and start studying. And it's just kind of like, what are you doing? The test isn't for like 4 weeks. Like,
Right.
and then we got the scores back after that first test. And it's like, oh, I'm going against people who are not only really smart, but they're committed to getting good scores on these tests, and they're going to work hard. And so you start making some decisions. Am I going to try to stay up with these people? It's like, well, yeah, I'm competitive. I think I'm here for a reason. Like I can do what they're doing. And it took a little while to figure it out. I did have to figure out how to study, even though I had gone through college and done the hard classes and MCAT. I thought I knew how to study, but I didn't know how to study on that day to day, every day for hours. I had to teach myself, and you figure it out, you experiment. Eventually I fell on flashcards, making flashcards, going through the notes, making flashcards, reviewing those flashcards, taking the test. That was kind of the process that I fell into. I needed to see something 3 times for it to click. And
Okay.
then
Okay.
that was for me. Obviously everyone's a little different. I was jealous of the probably near borderline geniuses, if not geniuses in my class, who they'd just go to the lecture once, maybe watch it on a recording, and they would have it. That wasn't me.
Right.
I
Yeah.
had to study and work. But I also learned how to not just memorize, is really understanding the concepts. And that helped me a lot when it came time to take the boards, is because I had a good understanding of concepts underlying things, and then I could fill in the gaps with memorization as the test came right up to the time. So
It's
um,
very interesting that you said that. I want to dive into it. And I know it seems kind of trivial, like, okay, I mean, it's kind of self-explanatory, understand the concepts. But my mentor said the same thing, and he was one of those, he came in ready to go. He's like, I'm going to set the table for these guys in medical school. And there's a little clip of him I posted, and it's all like how to study for med school, understanding fundamental concepts. And that's what got him his hundreds on his exams. So walk me through the practical steps of understanding a concept, because I'm sure you've had to refine that even now when learning new stuff for orthopedic surgery.
Yeah. So, I mean, to try to boil it down, you're getting thrown so many facts. There's just this does that. And when these two things do this, then this happens. And you could just memorize like, okay, yeah, that's the way it is. But if you go a little deeper and go like, well, why is that the way it is? What is going on? Whatever it is, whether it's the biochemistry, which I've now since totally forgotten, or, all right, you could memorize that, all right, the bone hormones of calcitonin and interacting with parathyroid hormone, and you can do these things and like, okay, well, yeah, you need vitamin D. All right, fine. But if you can really understand and draw out like this is going here and this is going here, then whatever question comes up, you're going to be able to go, okay, I can draw this out and go, yeah, okay, that's this feedback loop that's happening, because I understand the underlying concepts, not just the fact that spit it out. And so it's being willing to work that much harder initially to dig a little deeper, get beyond just the memorization of a fact, and truly understand that feedback loop, for example, or whatever it might be, so you can draw it out. And then when it comes time to answer a question that you may not have been able to prepare for, you have a deeper fundamental understanding, and it might take you a little time to draw out the thing, but then you're like, oh yeah, that's the answer. There it is.
Okay,
So
because I found drawing it out and stuff really helps for biochem too.
oh yeah,
Does that carry over
yeah.
for pathology and stuff too?
Sure, all of it. I mean, there's the Krebs cycle where you do have to just draw it out and learn it. And it's funny. There's so many things that I've memorized and then forgotten countless times. The Krebs cycle being one of them.
As you should.
Brachial plexus being another. But but
as a hand surgeon.
Well, you draw it out and like, so could I like go aside and like just kind of working through it all of it? Yeah, maybe, but it's like I haven't gotten it totally in my head of like, all right, the posterior chord's doing, that kind of stuff. But it's just being able to go beyond just the memorization and draw out the pathways and the feedback loops and all those things is so much more valuable to one, getting a right answer on a test, because you truly understand what they might be asking, but also when you have to start applying the knowledge. Mm-hmm. If you're dependent on like spitting out a fact, well, those facts go away when you're not using them. And if you remember at least the way things are supposed to work and why, you're going to be able to find the answer that much easier.
Okay. So perfect. So you're applying concept. Man, it seems like the best advice we can give people for learning things is understanding fundamental concepts.
And that's the case for everything.
I wish there was a trick, man.
No trick. No. It's work. It's work. And some of it is you're going to want to just like, all right, I'll just remember that. So many times I remember making flashcards, like whatever, I'll just remember that is the case. But I'm like, no, like really get into it. Why? And then you're like, all right, okay, I get it now. I get it. And being willing to ask the why and being curious is very helpful. And then when you're out, yeah, no,
go ahead.
Say? Oh, I was going to say, and then having those same ideas when you're out in the real world, when you have to relearn or learn new things on your own, because you're not going to lecture and you don't have people feeding you the information you might need for a test, you have to kind of figure it out. If you're not curious and trying to figure out why something is the way it is, then you're going to find yourself in a difficult spot. Say for me in the middle of a surgery, hey, I don't know what's going on. I thought I was going to be able to handle this problem pretty simply. This fracture looked fairly straightforward. this person has an anomalous muscle where it isn't usually, and I can't get the fracture lined up the way I want. What am I going to do? And you fall back on the fundamentals and the concepts, and you can usually work your way through it. But if you try to just memorize like, oh, well, this and then that, well, I can tell you for sure, vast majority of the time, even the simplest surgeries are not a straight line like that. So you kind of have to figure it out and be able to think on your feet. And if you understand the concepts, you'll get your way there. You'll figure it out.
Awesome. Awesome. Dude, thank you for sharing that. Okay, so away from the study stuff and just to tie it all together, once you understand the fundamental concept, are you writing that kind of stuff down on flashcards, or are you sitting there teaching somebody else perhaps? Or
yeah. So, I mean, the way I would then study for my tests, I was in isolation. I'd hide away, doing my
recluse.
flashcards, and in the flashcards, it was funny. It wasn't so much memorization where I'd see the question and flip it around like, okay, yeah, that's the answer. It'd be the working out of the flashcard, making it. That was kind of the seeding of the thoughts and the connecting all the things that need to be connected. And then sure, I'd run through right before the test, using the flashcards as flashcards, but it's the making of the flashcards that I think was really the most important thing. Yeah. And so, yeah, what was your question?
It was about like, did you add on getting to teach other people and using that as a way?
So I did tutor. I've always kind of liked teaching. And after doing well in the first year, then they offered actually a tutoring position to second years who did well, and first years who might be struggling. And that was the kind of the realization of kind of like, oh, yeah, I mean, teaching is helping me really understand these concepts, because they would ask a question like, well, I don't get it. Why? Or how do you remember that? And you're like, well, how, all right, let's figure this out, and it really nailed home understanding the concepts and the fundamentals. Because if you can't explain it to someone else, then you really probably don't know it yourself.
Right.
And the easier you can say it and explain it, the better you know it. It can be something very complex, but if you can explain it simply, it's probably because you understand it pretty well. And I'm probably paraphrasing a very smart physicist or something who said something to that effect. But, I mean, these people are exploring the stars and the atoms and things that I can't picture or understand. But you hear someone explain quantum physics in a way, you're like, oh, okay. Yeah.
Yeah.
I can picture that. And it's because they really, really understand it. So.
Right. Yeah, I think there's a technique named by a famous physicist, Feynman. You know Richard Feynman? I don't know.
I know the name. Yeah. I mean,
Yeah, that's who you're talking about. I thought you were making a joke.
No. I'm horrible with names, but yeah, Richard Feynman. I know the name, which means he's probably a famous physicist if that's what he does.
Yeah, that whole technique you're describing is the Feynman technique.
Well then.
Yeah, it's on every other YouTube video, how to study for med school, and it's like it's kind of that thing. It goes in one ear and out the other because it takes a lot of effort on your part.
Yeah, and I clearly didn't memorize the name, but I understood the concept.
Heard.
I got there. It stuck in my head. I remembered the concept. All right, and yeah, that brings up a thing.
Okay.
I graduated medical school 21 years ago, or I started medical school 21 years ago. Finished in 2008. And the resources, I'm sure, are very different.
Oh, yes.
So, I had textbooks. There's the internet, but there was no like great online source that you could go to. I remember studying for step 1. There's this audio. They didn't even call them podcasts at that time. There's this audio recording of this guy. I'm forgetting his name. But it was very valuable for studying for step 1. But I paid extra money for this audio study guide. But now I imagine there's just so much information out there. And it might even be the difficulty is figuring out what resource to use.
Yeah, because I was
Yeah.
gonna say the flashcards in our day now are digital, and they have these space repetition algorithms. And no matter how many times you hear it's good to make your own flashcards, everybody, like, I think I even paid for a pre-made deck through a guy that offered it. And so
Yeah.
there's like 55,000 flashcards. It's hard to resist. As a student, you're like $5 extra a cup of coffee every month, and I have thousands of flashcards already there for me.
I get it. I
Man,
get it. Um, and there is something to be said that when you get something wrong, you're going to learn that much faster. And so I guess if you didn't make the flashcards and take the time to make the flashcards, at least you're doing questions. And if you get the ones wrong, then those are the ones that you're going to learn from. Um,
you
and
would think, you would think.
you'd think.
Yeah.
I seem to recall the ones that I got wrong were the ones that stuck it with me a little bit longer once I figured out the answer. But
Did you guys
yeah,
have UWorld back in the day, or
there was something world. I
was
don't
it,
know.
or was it like a textbook full of practice questions?
I'm trying to remember how it worked. There was definitely some online question banks, and I definitely used those when studying for the boards.
Okay, because
But the
I was
book,
on my PlayStation when I was playing PlayStation while you were studying for boards.
yeah, I there was definitely online question banks that were totally worth it at the time. But the book that I would study from was definitely a textbook.
Okay.
And then I'd be going through this book and doing the question bank and writing answers in. And yeah, my book was is
You can't reset the book though.
no, no, you cannot.
You
And
get
oh
one
man,
pass. You get one
if I
pass.
lost that book during studying for boards, I would have been so depressed. I had written so much and studied so much, and yeah,
So, what was your life like? You said, because you sounded like a I'm just being funny when I say this, but you sound like a recluse, which I mean that in as a term of endearment, because you were
yeah,
serious and you were motivated and you were there for to do your job. Your job was to study, and I will say I got into med school, and as a younger man, I'm like, as long as I, study, as long as I get good grades on my exams, I can use my weekends as I wish, kind of thing. That's why I'm doing the research here, because I feel like I could have spent some more time trying to set myself up for success in orthopedics. Um, Being honest with myself, I didn't, and so I had to own that. And I said, well, that's a year of life and a year of learning. But how was that lifestyle like for you?
yeah. Certainly, at times I was a recluse. We'll say an introvert.
Okay.
Um, I like being alone. I get my energy from being alone and being within myself. I think that's kind of the definition of an introvert, as opposed to an extrovert getting their energy in social interactions. Um, so yeah, I mean, medical school, your job is to do well in school, and that means learn the things you're supposed to learn. And it's for a bigger purpose. You're going to be doing some important things when you're done. And so that was kind of the thing that I could kind of latch onto, is like, all right, this is a bummer, but if I do well here, learn these things, it's going to hopefully help people later on. Um, but I wasn't the type of person to study in groups. That wasn't the way my brain worked.
Me either.
Um, Certainly there'd be times where myself and classmates and friends would get together and maybe kind of review some ideas or concepts, or run out like, hey, do you get this? And there'd be the little interactions like that. But when it came time to study, I was alone. Um, and but then it was also, on that note, really important to get social interactions. It's really easy to just be in the library or the hospital or whatever all the time and be alone. You could be alone all the time doing what you're supposed to be doing as a medical student, but that's not healthy. So finding a balance, going out with friends, having a beer, watching a football game. We played intramural flag football, and got together and hung out, and so it was really important to get those social interactions, and for me also exercise was another thing that I was going to stay on top of, and I think it helped me come back to my studies feeling a bit better. My mind got a little rest and my body felt good, and all right, I can get back to studying. And so I continued doing jiu-jitsu, and I picked up boxing, and I did an MMA fight in medical school. So that was another
That's awesome.
balancing thing to the stresses, the grind of being a medical student. I was out doing other things and trying to have a counterweight to the things that medical school can just kind of suck you into, and you never leave. So I definitely implore all medical students, have something to balance you out.
Yes.
I, of course, think exercise is really important, but social interaction is also incredibly important, and are as important as studying most of the time.
Right. And so it was funny because we went into the first gym that my roommate took me to when I moved into North Carolina med school was Planet Fitness. And I walked in there. I said, I'm gonna give it a shot. I said, hey man, let's go do some bench press. He goes, hey, there's no free weights here, brother. And I said, well, this is the last time we'll be here, me. So the next day we found Bull and Bear Gym, and it had a jiu-jitsu, because the gym's got to have other sources of revenue too. And it seemed like a safe haven for former military, really intense individuals, including our little group of guys, I guess. And the owner was super cool, very laid back, and yeah, there's jujitsu going on the whole time we're working out, so we could just peek in there and see what's going on. And it was awesome. And this whole time I've been listening to Jocko since I was 19, wanting to be a Navy SEAL at one point. So I've just been hearing about jiu-jitsu. I my buddy back in Georgia going to it just actually did his first competition in
Nice.
jiu-jitsu. He's a former football player, big old guy. But he's been rolling, telling me about it. He loves it. He's telling me, "Hey man, you got to go do jiu-jitsu." And so when did that journey start for you? Let's branch off of the boring
Yeah,
stuff and
yeah.
go to more
It's
of the fun
get
stuff.
back to jujitsu. So I was very fortunate to be introduced to jujitsu while still in high school,
Ah,
and a wrestling coach of mine was doing it, and he's like, "Hey man, you should check this out." And so I did, and while I was still in high school, and so I got introduced to it and did some competitions. And when I went off to college in San Diego, there was more jujitsu down there. So once I kind of got my life together in college, I restarted doing jujitsu in San Diego. And well, San Diego is kind of an epicenter, a mecca, if you will, of jujitsu. And so I was able to kind of learn and be around some pioneering people in that world.
like who?
And, so Roy Harris was one of the people who was formative to my training while in college, and he was one of the first American black belts. And he also
Wow.
he was into footlocks before kind of just about anyone, maybe other than Dean Lister. And Dean Lister is
Mm,
also a San Diego guy.
okay.
And Dean Lister won world championships, being on the forefront of techniques using footlocks and things like that. And more or less, I mean, there's just so many schools. The amount of knowledge just in San Diego is pretty deep. But it started with guys like Roy Harris and Dean Lister, and it was Fabio Santos who is the Brazilian black belt who taught Dean Lister for a while. And so you've got these people who are there, and I was very fortunate to be able to learn from them. And later, when I came back to San Diego for residency, I was able to learn directly from Dean. So yeah, and yeah. So the jiu-jitsu journey, I competed along the way, and I was okay at it. But I was a hobbyist because I was in medical school or I was doing other things,
Right.
and it wasn't like I could train 6 days a week. But in medical school, if I could get twice a week, that's good. That's great. So that's kind of where I've been, and I kind of joke I've been a hobbyist for 25 years, and I've gotten pretty good to sticking with it for 25 years. And there's certainly times where I was able to train a lot. And then there's times where during residency for a few years, I didn't train at all. So it's the way it goes. You prioritize and you figure it out and just kind of keep going.
Right. So, are you still competing, by the way?
No, it's been a
Okay.
while.
Okay.
Sadly, I am not skilled enough to just walk out there and compete well. So I would need to practice and put together some training camps and get in good shape. And it was about 2 years ago, almost exactly, that I was getting in very good shape and feeling good about my jiu-jitsu. And now that they have masters divisions and stuff like that, I could go against some other older guys. And I was like, all right, here we go. I'm going to sign up for this tournament that's going to be in San Diego. It's going to be in 6 weeks. I got the browser open on my internet browser, and I go and train that night, and I tore my pec. It
Was
was
this
the
after
first.
residency or before?
No, this was just 2 years ago. This is
Okay.
I'm out in the real world, and yeah. So I hadn't competed. I hadn't competed since doing MMA. 2010 was my last MMA fight, and that was the last time I'd really done any hard competitions. And because of residency and training and getting my career started, but I was almost getting back into it, and then injury, getting old. Yeah.
Well, so walk me through your pec journey, because I think I told you happily at the conference. I was like, I tore my pec too. But I tore mine during med school, just doing heavy bench press for no reason while I was probably undernourished and underslept and all the stuff. What was that
Yeah.
like for you?
It was a very interesting time of my life in that I was going through a divorce and the uncertainty that goes from that. And I fell on jiu-jitsu as like, all right, this is how I'm going to stay sane. And so I was training a lot and getting in very good shape, feeling good, again, talking about competing again.
Yeah.
And I was deciding whether I was going to try to cut weight to make the weight class, or if I was going to try to bulk up a little bit to be a weight class above me. And I decided I was, all right, I'm going to bulk up a little bit. So I start lifting heavy.
Mm-hmm.
In hindsight, maybe I wasn't as focused on my recovery and nutrition as well as I should have. But, it's not like I was neglecting myself, and I wasn't a resident that was just completely sleep deprived. But I, sure, I'm a busy orthopedic surgeon, but also training a lot. And I had done some heavy deadlifts, probably neuromuscularly fatigued. And then we're going to roll hard, and I get paired up with a guy who's a good friend and very good at jiu-jitsu. We've rolled with each other hundreds of rounds. And something happened where he's moving to get behind me, and I do a cow catcher to stop him, and eccentric load, bam. And just like, oh, wow, okay, out of nowhere, I'm hurt.
It's like a cramp. For me, it was like a cramp that kept going. It was like cramp, snap, and you're like, that's not supposed to happen. Okay, now I can't open. Now I can't. Wow, there's so many things with this flexion
Yeah.
at the shoulder that I'm missing now, and I learned real quick where exactly it attaches. And I went over to my school. I said, "Hey, could you guys check me out?" They're like, "We're not allowed to touch you guys, actually." And I'm like, I go to the actual orthopedic surgeon, and he just does like a hook test right here and goes,
Yeah.
"Yep, you tore your pec, man. So we're gonna, if we take you in, because a good surgeon, we'll talk about that. A good surgeon should know when to operate, when not to operate. That he's like, you're a young guy, you're gonna want to lift again, right? Yes." He's like, "Are you worried about being a bodybuilder anytime?" I said, "I probably should not expect to be a bodybuilder, right?" He said, "Yeah, because I can get you functional and you'll be able to lift as much as you were back in the day, but it's just not going to be aesthetically as pleasing." So, how was your surgery experience?
It was funny. So I knew what happened immediately, and I had to first cope with the fact that now I wasn't going to be able to do jiu-jitsu. which had taken an oversized importance in my life up to that point.
Right.
And so that was rough. And then it's kind of like, well, I could probably still work with a torn pec. I can still be an orthopedic surgeon. And so I kind of was at a very busy time with work, call, life. And I was like, well, let's give this a few weeks to kind of see, do I really need the surgery? You know, I'm 40 years old. Like, I'm not going to be a bodybuilder. Like, we'll see.
Yeah.
And is kind of realizing that I was noticing not having a pec, even just kind of pulling the mini C arm over to me in the OR. I'd notice like, oh man, like that doesn't work the way I want it to work. Or I'd be snapping in the adapter on the drill and I'd kind of notice like, man,
all the simple things.
Yeah, all these little things I'm kind of noticing and like, that's going to really probably annoy me. And then of course, like I know a pec is important for exercise, for fitness and for all those kinds of things. And so I decided, all right, I'm going to have surgery. Fortunately, I knew some people and could set up the surgery pretty quickly. And so about 3 weeks after I had done it, and I'd gotten to a place where I could take a little time off. I had my pec repaired by my colleagues. They did it. And,
That's awesome.
you know, all in all, the recovery was as good as I could have hoped as far as the immediate, you know, pain control and all the stuff that goes along with it. I think
Did you get a nerve block?
I did a single shot block.
Okay.
And had the ice machine, but I only took Tylenol and naproxen. That's all I took, Tylenol and naproxen. And a big part of it was there was no anxiety. I knew exactly what to expect. You know, it's a surgery that I do. I trusted the people who were working on me. I there was no surprises, nothing that I was concerned with. And so the pain that was there is like, yeah, it's supposed to hurt. You know, people drilled into my bone and moved tendons around. Like it's supposed to be a little uncomfortable, but I'm fine. And it was a realization that so much of what our patients are going through, and while they say it hurts, they're anxious about the discomfort they're having. They're layering thoughts on top of a feeling like, yeah, it hurts. You have an injury, but they're layering all these other thoughts on top of it. And they're so anxious and they need those extra pain medications, probably just to kind of numb them, dull them, so they're not anxious anymore. And so since then, I've been doing my best to do what I can to reduce anxiety. You know, it's one thing to like, oh, yeah, you got a broken bone, I'm going to fix it. But sometimes you can tell a patient needs a little more explaining, or you need to really bring them through the whole process of what that's going to look like, or just making them feel comforted. As orthopedic surgeons, it's pretty easy to go like, yeah, it hurts. Broken bones hurt. What do you want from me?
Yeah.
And I probably did that more than a few times. But I think reducing their anxiety and making them feel cared for and comforted reduces that anxiety. And so even though the pain hasn't necessarily changed at all, they now feel like they're being taken care of in a different way. And so it was valuable. And it was the realization that I got after going through my own surgery. And because I didn't have any anxiety, Tylenol, naproxen, whatever, like, why can't all patients do that? And It's not because I'm particularly tough. I'm not, but is because there's no anxiety around. So I've past couple of years been trying much harder to at least acknowledge how a patient's feeling and making them feel somewhat comforted. But at the same time, you have to be a little detached and go like, you know, this is
it's
it.
a balance.
This is what we're doing.
It's a balance, isn't it? Yeah.
It is. And it's a struggle to find that balance. And I probably erred too far on kind of the aloof detachment and like, look, you got a problem, I'll fix it. And I would fix it, but it didn't necessarily make them feel good. Unfortunately, there's that touchy-feely thing. But if you help them feel good about the process goes better and my surgical outcomes are better. So So it's valuable to at least acknowledge that those things exist. And, certainly not perfect. Some people, you're not going to be able to reach them in a way that gets them out of their primitive brain. That's just not where they're at in life. Too much to
Okay,
uncover and bury there.
right.
But at least if you're trying, they can at least try to appreciate that you're there.
So does that start more, have you had more success with that pre-op, at like laying the groundwork for this is what you're about to go through. This is going to be a hard road ahead, and kind of setting them in that frame of mind versus post-op, and they're having the pain, they're having the anxiety, and addressing it there.
You definitely pre-op have to do a lot of work, and it's work that they're probably not going to remember most of what you say, which is frustrating because you get the same question over and over and over again. But if you get them to at least leave your office feeling like, hey, all right, my surgeon cares about me and he's got a plan, we're going to do this. Like that's what you hope that they're going to come out of that pre-op appointment with. And if they remember all the other stuff you talked to them about, like, hey, this is going to hurt. We're going to send pain medications. Hey, I'm going to want you to start therapy at this time. And you can go through that whole process, but they're not going to remember any of it. So that initial coming out like, hey, this doctor cares for me. He's going to take care of me. Like, here we go. Like, we're going to do this. And then afterwards, that's when hopefully the instructions are going to be a little bit more valuable because now they're in it. They're done thinking about the surgery because it's done. And now you can go, all right, yes, it hurts. I'm sorry, but I cut you open and moved your bones around. It's supposed to hurt. In fact, if it didn't hurt, I'd be a little worried. And, you've got pain medications. Just know that this is all a normal part of the process. And we're going to get you through it. And we're going to get you started with therapy, which is also going to help next week, that kind of stuff. And every patient's going to be a little different. Some don't need as much handholding. Some need a tremendous amount. And as you interact with people more, you kind of start figuring out who's what and how it goes. But, I guess this is a good time to bring it up, is just no surgery or patient is exactly alike. And as a surgeon, you got to figure out what's going to be working best for all the situations. And so I know how to do a carpal tunnel release. I know how to fix a distal radius fracture, but I am still learning how to get the best outcomes based on the patient, based on the fracture pattern, based on all these things. It's continual evolution and reassessment on what I could do better.
Yeah, because you said something in an old video I dug up. You're all freshly shaved, probably like one of your first practices or something. And they were like, "What do you want your patients to know?" If I want my patients to know one thing, it's that I care. Every
I
patient,
think I
you're saying
remember.
the same thing. Yeah, every
I
patient is different, and that really hit home with me. I appreciated that.
way less gray hair with that video. And and the rules of being a new doctor, it means they say it about surgery, but it's probably about anything when you're coming out of your training. You have to be affable, you have to be available, and then of course you have to be able to do these things. And it's you kind of intellectually know, like, yeah, I care about my patients, but figuring out the ways to show that to them is for me a continual progression. There's some people, and you've probably know them, maybe even your med school class, where they just get an immediate connection. They're just so good at like making friends and those interpersonal relationships that just happens for them. And awesome. Like, they're great. That's such a good skill to have. And I'm working on it. I'm trying.
Yeah, I got called out on my because my dad is a guy who doesn't have never met a stranger in his entire life, and so I kind of do the same thing. And my boss over here at the school, he said, "Hey, so you're really friendly, really chill guy. That's great. but like probably don't want to be throwing around attending's first names like you guys are buddies. And I was like, Roger that.
Yeah.
Understood.
Yeah.
So
Yes.
yeah.
Yes.
So I have the opposite problem. I'm like, I just assume everybody wants to be my friend, and I get really involved with everybody's case, and I get very emotional. So for
Well,
me, it's much harder to sit down and study for 8 hours.
all right. So different sides of the coin. Those skills that you have, those attributes you have, are going to be valuable at the right time. There's gonna be times you're gonna have to lock yourself away and get ready for that test. But at the same time, when it comes to being out in the real world, or you're still in training, but you want to do well on an interview, or you want to meet somebody to get a letter of recommendation, like those are really important things. And so you got it. You're on it. You're good.
Thank you. I got that part figured out. I got to get all the grades figured out too, and board scores. So, but while we're talking about that, we got to go back to the med school.
Mm-hmm.
So, because you had talked a little bit about the fact that you wish you had been a little bit more open to reaching out to people and making the calls and the emails or whatever you had. So going back to med school, you're doing okay, you're tutoring, and you're trying to figure out what specialty that you want to do. You've got an inclination for sports, obviously.
Well, yes,
Okay.
an inclination
Okay.
for participation of sports, but I
Okay.
was thinking about emergency medicine.
Right.
That was what I
Okay.
was leaning towards the most.
So what was
And
your coming out
yeah,
experience
so
as
I
far as
started going on
NCO?
my way second year to
Hmm.
kind of shadow in the emergency department and kind of do some stuff and see things a little bit earlier than the clinical years. And with my experience there, yeah, sure, there's a momentarily exciting thing, but then there was a lot of your primary care for this family with the flu, or you see something that's kind of cool and exciting, but then you just call up the specialist who actually is going to take care of it. So it lost its luster. It was like, oh, all right, like this is not what I imagined. Some of that is kind of all right. It's not how Hollywood portrays it. Uh,
Right.
but I started to realize I really liked procedures. So like there was one time someone let me do some stitching, and I was like, that was like the highlight of my month. Like I put
Yes.
stitches
Yep.
into somebody. Like that was so
Yes.
cool. And then
Mom, look what I
yeah.
did.
Yeah, and then there'd be a time where someone lets me try to put an IV in, and it was the procedures that I started keying in on, and then is actually really when it like, okay, this is what I'm supposed to do is surgery, is when my first clinical rotation of third year was OB-GYN, and I jumped in on every C-section I could, not because I loved the C-section, but it was being in the OR doing a procedure. And that was the realization. I was like, oh, okay, I guess I'm into procedures and surgery is the way we're going.
Hey,
But I
so what was
will
your game
say,
plan? Yeah, go ahead.
well, I will say that by throwing myself at everything that I was doing,
Hmm.
I was able to figure that out. There's a lot of people who, oh, I'm going to be a pediatrician. I love kids. I just love kids. This is what I'm going to do. And then they don't go out and do those experiences and really feel what it is to do pediatrics until they finally do their 3-week clinical rotation on pediatrics during the third year. And they're like, okay, yeah, that was fine. I still want to be a pediatrician, I think. And then they actually get in the real world of pediatrics and they're like, oh, this is not at all what I thought it was going to be.
Right.
So there's all kinds of stuff like that. But because I was just kind of throwing myself at everything, I kind of made the realization like, oh, procedures. Oh, in the OR. I really like that. Oh, okay. I guess I am a surgeon.
Hmm.
um,
And you got that clinical experience early in the ER too,
I
to
went on
kind of
my
help
way to
explore.
find it.
Yeah.
Yeah,
Yeah,
that
exactly.
was an optional experience, but I was kind of like, oh, let's do it. And so as I started to think more about surgery, I was like,
Hmm.
well, I'll be a trauma surgeon. I like ER, emergency
Yep.
medicine. I'm going
It's
to
a
be a
natural
trauma surgeon.
progression. Yes, sir.
Um, and then I experienced the general surgery side of things. I was like, not lighting that fire. And then I had a 2-week rotation on orthopedics. And it was kind of funny. I mean, I knew I was enjoying it, but these were long days, 16, 18-hour days. But I remember coming out of the OR and I'm wearing my little arthroscopic booties and sweat soaked through from lead, and come out and I kind of like hands on the hips, kind of like,
Yeah.
this is a good day thing. And one of my classmates saw me and they're like, "You like this, huh?" And I'm like, I love it. Yeah, this is it. This is what I want to do. And that was towards the end of third year. So
No.
I was a little behind on the letters of recommendation and the research and all the other things that go along with it. But it is what it is. I figured it out, at least. There's a lot of people who never figure it out, or they figure it out in the middle of the residency that they decide they don't like. So at least I figured it out.
Right.
And, I had gotten along well with the people that I had worked with, which was good. I had gotten good grades throughout, so that was good. I had barely any research to speak of, which I imagine nowadays would be a death knell to my application. Back then, it didn't matter as much. And so I was able to kind of make it happen, pivoting and kind of going all in with orthopedics and going in that direction and scrambling to do it. I think a big helpful part of my applications were doing away rotations.
Yeah, because how did you? So you said you had to scramble, and I've heard similar stories from the older gentlemen who are more experienced. They were always like, "Yeah, I didn't know I wanted to do orthopedics till the last like rotation," and I don't know, I just did it, and I'm like,
Yeah.
grief.
Yeah.
This is a 4-year plan you got to have these days.
Times are different, and
It
I
is.
can empathize with those of you who are going through it right now. And unfortunately, there's these tracks that you have to be on, or you're behind the ball, and it's a bummer. But I can say that it's best to at least figure it out late than to never figure it out. So throw yourself at everything. Have an idea at least of what you want to do, but throw yourself at everything, commit to everything, work hard to keep your options open, and then change if you need to.
Right. Did you have any mentors along the way that really kind of inspired you to, or because I've had some bad interactions, or no, sorry, less favorable interactions with attendings in certain specialties, and then I had a couple of good ones where I was like, oh, thank God, because if I hadn't, I don't know if I would have been on that track. You know what I mean?
No, it's the importance of mentorship and interactions and the weight you carry. That crappy interaction you had with whatever attending you had, and maybe they're having a bad day, maybe they got all kinds of other stuff going on in life.
Yeah.
Whatever. But your career trajectory has been altered because of it. And it happens all the time. And no one's perfect. I'm sure I've pissed some people off, or at least the interaction
No, you're
didn't go
such a nice guy, man. How have you
the interaction didn't go as they had hoped. And you just got to realize, like, your interactions with people who are young, hungry, interested, it's important. It's an important duty to at least open their eyes to things, or guide them the best you can. You never know, you might completely alter someone's life with a bad interaction. I mean, that happens, and I definitely had some interactions throughout my training in medical school of kind of like, oh yeah, I'm not going to be a neurosurgeon, screw those guys.
Really? Okay.
And there's some people where you have an interaction where like, that guy's really cool, anesthesia might be cool. But at the same time, you kind of realize what's really keying in. But you have those good interactions with people, and it completely colors the thoughts around a specialty. And to those of you medical students out there who might be listening, like, don't try not to let that one interaction shift your trajectory too much. Let the data accumulate a little bit. If you have 3 bad interactions with 3 different attendings, like, okay, all right.
Your sample size is good.
Yeah. But with orthopedics, I just vibed well, you know.
Hmm.
The fact that I was boxing and doing jiu-jitsu and did an MMA fight and that kind of stuff, like the ortho residents are like, okay, all right, all right, you can work. Like I can see this, and we got along well, and I could show I could work hard. All right, it's 4 a.m. We need to get up and do something. Let's go. Like let's do it. Um, and so it, and then I did my away rotations and kept that attitude, and was able to interact with the people who would eventually make a decision whether to have me in their program or not. And I think it paid off. Um, Funny story about UC San
Okay.
Diego.
Yeah, I was going to ask. I was like, how did the away rotation at UC San Diego go?
Yeah. So it was funny because they have kind of different rotations depending on the hospital. They've got their main trauma hospital, which is probably the rotation you want to get as a sub-I,
Okay.
because that's where you're going to interact and do most of the stuff. I ended up getting put at the VA, and it was me. I was the only sub-I there. There was maybe 2 attendings, so not a lot of people who are going to be able to vouch for me if I did well. And then there was 1 team of residents. But I worked hard, did my stuff. The opportunities came up to take some call at the trauma hospital, so I did that.
Okay.
But there's a 3rd-year medical student there who is a student at UC San Diego who I was in the same fraternity as. And so we were kind of getting along, hanging out,
Yeah.
and he was a big guy, 6'2", 6'3", 220. He had started the wrestling club at UC San Diego, and the chief of the VA service, she thought it'd be funny to have us do a wrestling match on the front lawn of the medical student cafeteria at the time. And I got the better of him.
Oh, all right.
And
Let's go.
that's how I got into UC San Diego. um,
No way.
that really happened, and I'm sure that Suzanne Steinman, who is the chief resident at the time, put in a good word for me. Like, hey, this kid can work hard. You got good board scores, and I had him do a wrestling match on the front lawn, and he did good.
So they had you wrestle for a residency spot. That is the
Yeah,
coolest story.
yeah. And I've
How
been
did you beat
preparing.
how did you beat him? Because the
Um,
size difference, I
oh
don't know
yeah,
how tall
size
you are
difference.
now, but
I'm 5'11", and
okay.
so he had height on me, but he went for a head and arm throw, kind of classic head and arm throw, and I was able to see it coming and pop my head out at the last second, and was able to take his back, and
Dude,
so
that's a legendary story.
and
That's probably the coolest ortho residency story. I thought you were
yeah,
gonna tell me about the sub-I, like some embarrassing attending moment or something, but this
no,
is
no,
cool.
no. That's but sometimes a residency and a field is meant for you, and kind of everything I'd worked up to that point culminated at that moment, and it worked out for me.
Okay, so again, we gotta verge away from the boring stuff. More about you personally, because you kind of talked about just now everything kind of coming together for you. And one of the things that has kept me as a loyal follower for these past few years has been your constant sharing of the philosophical stuff on the Instagram. And that's the kind of stuff that I enjoy. And I've gotten access to a couple pages because you had kept posting them. I'm like, I gotta follow these pages. These are so good. So what is kind of like your underlying mental framework that kind of informs what you do?
Sure,
Can you kind of talk about that?
I could certainly try. It's something I'm
Okay.
still figuring out.
Right.
Carl Jung had a quote that I'm paraphrasing, but essentially it's the first 40 years of your life are just research. And
I
it's
love
kind
it.
of, all right, I got to that point, and it's kind of like, all right, well, I've been figuring stuff out, and what is going on? Let's understand these concepts. Like, what is fundamental to life? What is purpose? What is meaning? What am I trying to do? Uh,
Wow.
and you work so hard, medical school to residency to getting your career going, and you kind of just got your head down. You've got a track to follow. You're not doing anything that other people haven't done. You can just kind of get into that groove and go and just work hard doing it. But I got to the point in my career where I kind of pick my head up and look around, and it's kind of like, all right, well, what is going on right now? And I mentioned I went through a divorce, and that was kind of a life-changing thing, as you can imagine. And I was kind of unsatisfied with some of the work I was doing. I was kind of frustrated with the business of medicine, which unfortunately is life. Got to earn money and pay off loans and raise a child and all those things. And so there's just kind of this point in life where it's like, man, I've done everything right. But I'm not feeling content.
Okay, so talk about contentment for you these
Yeah.
days.
And well, I had to figure out what that looks like. What does that mean?
Right.
And I had checked all my boxes. Been doing jujitsu. I was good at it. I had a family. I had a career. I was doing the job I liked doing. I couldn't imagine doing something else. Fortunately, for the most part, my family is happy, healthy. Okay. But then things started falling apart. You're unsatisfied. You're kind of like, all right, well, what did I do wrong? That was
Yeah.
my thought. Like, where did I go wrong? And it's like, well, no, perhaps it's not that I did something wrong. It's just I've been, thinking about things in the wrong way. And that's when I kind of like, I don't know, you read some quote somewhere that someone puts up on the internet and it kind of resonates with you. And you're like, oh, okay. Albert Camus, like, what's his deal?
Yeah.
So you read a little bit and you're like, huh, all right. I don't know if I'm not a complete absurdist, but I some of that resonates with me, I feel like Sisyphus, and
Pushing the
that's
boulder
okay.
up
Yeah.
the mountain,
Yeah.
right? Yeah.
But Sisyphus could still be happy, like, all right, okay. And then let's look into it. And then I read a little bit about Taoism, like, all right, this is interesting, different idea. And then what's hot right now is Stoicism.
Yeah.
And a lot of those things kind of also resonate with me. And so you just kind of have this realization like, oh, philosophy. These are people trying to explore the underlying concepts of life,
Existence.
make it
Yeah.
make sense. You're not memorizing a fact anymore. You're trying to understand at its deepest, most fundamental level, what is life? And there's different philosophies, and none of them are right or wrong, but you kind of like, oh, wow, well, these people 2,000 years ago were having the same thoughts that I'm having right now. And so it connects you to something much bigger, that there's this fundamental human nature, and that you're not alone, because, dude, people thinking about it 2,000 years ago, there's definitely people thinking about it now. And it just kind of forces you through curiosity and wanting to understand, that you kind of dive into it a little bit more. And have I found the solutions? Do I know the purpose of life? No. Do you need a purpose to feel content and satisfied? I don't know. But if you can take, moment by moment, and I've found it helpful to, as a surgeon, and I help someone, that's gratifying. That's great. That feels good. I teach someone something and they can take that knowledge and help other people. That's even better. And so you kind of like, all right, well, these things are the things that make me feel good, and they're valuable to society. And it's something I can keep doing. It's not, I don't need $1 billion, and I don't need a private jet, and I don't need to live in Hawaii. These are, I can do all of this stuff that makes me feel good, but I got to figure out these things. And so it's been exploration that I've really kind of been focused on for maybe 3 years of figuring out the concepts of life. But I'm glad you like some of those philosophical quotes, and it's just kind of, I'll be scrolling and I'm like, that's a good one. Send that one out there. And it's just funny because, no matter how alone you might feel or isolated you might feel, there are people who share the exact thoughts that you're having, and there are people who dealt with and overcame whatever issues thousands of years ago.
Mm-hmm.
And also, it's going to all repeat itself. And so maybe you can be that person who helps influence and shape future generations so they can deal with whatever comes their way. Yeah.
Right, right. Because going back and thinking about Marcus Aurelius sitting down and writing stuff in his scroll, he's not thinking, "Oh, this is going to make a great quote for somebody's Instagram." At some point.
Absolutely
He's
not.
he's going through it and he's just writing it out. Like, this is what's happening. This is my reflection on existence. And I think
Totally.
like having a unique reflection on your own existence, brings out some really interesting things, because when you get the opportunity to share it, like you've gotten to share here today, then it comes out of you just sitting and like ruminating on your own suffering, or your own joy, or the good things that are happening, and maybe it helps somebody else. So
Yeah.
there's utility. And so how do you feel about, um you said you were going through it there for a second, and did you ever get into the mindset of maybe it's not happiness that's the important thing to chase? Maybe it's a sense of fulfillment that you became more preoccupied with.
Yeah. I think it is the realization that, you know, being happy, what is that? Like, hey, my 49ers won last weekend. I'm happy, but all right, cool. But that intrinsic satisfaction, whatever it is that motivates you or me, once that is satisfied, then you feel truly that much better. And it's not something that is going to be able to be taken away easily either. Um, if I enjoy teaching and spreading knowledge,
Hmm.
and I put up a video on YouTube and it gets 100 views, but one person leaves a comment going, "Hey, this is the best video I've seen on this topic." That is great, and that will never be taken away. And hopefully, then that person now knows more just because I put a little extra time in, and that is so much more fulfilling than some of these superficial things that we kind of, our society makes us fall forward to day, and we just can't be what we should be in seeking fulfillment. And it makes you think about, just clearly there are some things that people shouldn't be doing that makes them feel fulfilled, that aren't beneficial to themselves or to their community. But I think for the most part, human beings, there's this intrinsic desire to cooperate, to communicate, to work together, and be part of something bigger. And if that's 90% of us, then I think then a philosophy in that way that works for 90% of the people is pretty solid.
Yeah, I agree. Um, yeah, so tell me about, you talked about the joy that you get, or the fulfillment that you get from getting just one person, impacting one person on your socials. What made you want to start sharing stuff on social? Because I honestly, it's still a little weird for me, because here I am, the white guy trope with a microphone, and hey guys, listen to my podcast, please.
Yeah, it's interesting. Like, when I decided, all right, I should do it, it was the middle of COVID. And so I had a little more time. I really didn't know what to do. I was feeling a little isolated. I wasn't interacting with patients in the same way. And it's like, all right, well, what else am I going to do? And I had started to see some of the value of having social media to interact. And then I think I watched some video on YouTube and I'm like, this is garbage. Like, this is all wrong. But he's got, 1 million views. And it's like, well, if you're going to be a critic, like, let's see if let's see if you can do it.
What video was that?
I honestly don't remember
Okay.
the
Okay.
specific
I was like, let's call him
topic.
out. Let's call him
Yeah,
out.
no, even if I did remember, I wouldn't want to call him out. It's not my style, but um, it's just kind of like, all right, well, why can't I start putting some stuff out there? And going from a person who had never talked on camera to an unknown audience to now trying to make it somewhat regular. Um, it's been a process. I can't say I'm gifted or exceptionally good at it, but I'm getting better. And I think some of the knowledge I'm putting out there has been valuable. And I kind of started with topics that I found myself saying a lot in clinic. And it's like, well, maybe I could have a patient watch this video and then it saves me time in clinic. Um, but then it kind of just snowballs and like, well, I'm feeling like talking about this topic today. Like, let's do it. Let's talk about it. And sure, there's times where I kind of go down a pathway. I'm like, well, I might get a lot of clicks if I say this or do this. But is it going to make me feel good? Am I going to be fulfilled by saying that? Or am I just saying it because I think it might get a reaction?
Right.
And in the end, I've tried to, for the most part, default to what I can be proud of putting out there, saying, even if it's flawed, it's not something I don't believe in, you know? And while you got this podcast going, and I think you've got a great topic, and I'm sure medical students out there are searching for answers, and hopefully they'll have the time to listen.
I'll try to chop it up.
Yeah, you're not going to be doing it to get 1 million subscribers on YouTube. You're doing it because maybe one of your classmates goes, hey man, that interview was awesome. It really resonated with me. It gave me some stuff to think about. And if you do that enough times, then maybe you do get that 1 million subscribers, but that can't be the motivation, because then it becomes fickle. And you see what happens with all these social media big names is they start going kind of off the deep end because they keep going after the clicks. They have to stay in this weird environment of reactionary, saying crazy stuff just because it gets the eyeballs. And that would be a little form of a nightmare for me, to kind of be caught in that world of like, I have to say something provocative or my followers might unsubscribe. Like, how unfulfilling is that? So I guess my advice is to stay true to what fulfills you. And I think you've got a good message and you can help some people. May not be rich and famous doing it, but that's okay.
No, I can't stay out from behind or stay out from in front of a camera. Like, I looked back at before I had to delete my old YouTube videos before this, and it was like I had just recorded stuff I was doing in life. I had skits back in like middle school, and it was just something I habitually get into. And now I have this I have this time. I'm busy I'm working like 10, 12 hours a day usually. This is the only day I will not be working that much. But I was like, I got so much out of listening to podcasts for so many years. Like, listening to Jocko's podcast made me want to be a freaking surgeon. But then I heard Peter Attia on Jocko's podcast, and then I'm like, this is where I'm at now in college. I kind of want to go into medicine, and this guy's journey is inspiring, and he's bald and he's cool. And so I was like, I'm looking around and I don't see anybody sitting down and talking from the middle of their journey and asking for help and saying, okay, help broadcast your message to me, but also to everybody else that might be searching. So that's what I'm just trying to do it. And I don't know who's going to say yes. I shot you a text and I didn't think you'd say yes. And so I was like, I guess I have to do this.
Yeah, no, I mean, put it out there. You never know what might happen. And I think it's a great idea that you got, I've done my research, and I'd like to think I know a few things, and certainly the work isn't done. It never ends. If you're going to go into the world of medicine, there's always ways to get better, whether it's with medical knowledge or how to interact with people or how to navigate our medical system. There's always things to be improving on. And so that never stops. And the hard work never stops. So those of you who might be listening who think like, oh, when I'm done with medical school and or residency, like, oh, it's going to be chill. Nope. No, not if you want to be good at whatever you
Right.
end up, if you intend to be. If you want to be good at it, you got to continue to go and work.
Well, that's a
And
perfect launching point because I know we got to get you out of here at some point. I know you've got to go operate on Dwayne Johnson or something here soon.
yeah.
Um, but I gotta know how the transition getting into residency, you wrestled somebody to the ground that got you in, okay?
Yep.
And so walk me through residency, what that experience was like for you. You ended up discovering hand surgery at some point.
Yeah.
Walk me through
Yeah.
that journey if you don't mind.
So again, no plan to go into any particular field of orthopedics. Sports, of course, was on the radar. Being interested in trauma or traumatology was also on the radar. But it was throwing myself at everything, working hard at everything, and realizing I had kind of an aptitude for the hand surgery stuff. When I did these things, it made sense to me. I could make sense of it, and I felt like I was good at it compared to perhaps other things. And I definitely enjoyed doing it. And I saw that there was also a component of hand surgery where you could do a lot of stuff with hand surgery. You can do pediatrics. You can do a purely elective, life, or you can be doing a lot of trauma call or everything in between and do sports. You can do a lot of things with hand surgery. And so,
Yeah, and can I
so
ask you for a second, just to kind of give myself, selfishly and everybody else, kind of a scope of how we currently sit in hand surgery. Because from what I understand, it used to be more distal focused, pure hand, and now it's starting to, the specialty is more of a hand upper extremity type of environment.
it's interesting. And I don't know if it's been a change, but people are kind of more aware of it.
Okay.
Maybe there's kind of this pendulum swinging where, 50 years ago, everyone was kind of a generalist, kind of doing everything. And then, yeah, sure, you'd have a hand surgeon kind of really focused in on the hand, and I just do the hand. And that's kind of where all this energy went. Um, and, maybe the pendulum swings a little bit back and they don't want to go like, I don't want to just be doing wrist and finger stuff. I want to do further stuff up the arm. And hand surgery can still mean a lot of different things. I think most call panels are going to consider hand stuff wrist to fingertip. So
Okay.
if it's elbow or more proximal, you as the hand surgeon are not going to be expected to do it, but the general orthopedic surgeon is going to be expected to do it. UC San Diego, we go up to the elbow. When I first came out into practice, I was doing shoulder arthroplasty. So I was kind of doing a whole arm, but I've since narrowed that down. I didn't really particularly enjoy shoulder arthroplasty. And there was 3 other sports guys in my office who really liked doing the shoulder arthroscopy. So I was like, well, I don't really like shoulders. Why am I doing it? And so I've since focused my practice where 2/3 what I do is elbow to fingertip. But some fellowship programs truly are wrist to fingertip. And then other fellowship programs go all the way up to the shoulder, and you kind of got to figure out what you might want to do if you want to go into hand surgery.
So
And
no
some
pun
people do.
intended, it's kind of an arms race.
Yeah.
I'm sorry.
There are some people even do 2 fellowships where they do a shoulder elbow fellowship and then like a hand fellowship to be comprehensive arm. But then you're doing 2 fellowships and
Yeah, dude.
it's a lot. And
Where did you end up? Dang it, I did my research and
the
so I should
fellowship,
know.
the
Yeah.
fellowship was at the Campbell Clinic in Memphis, Tennessee.
Oh.
And
Oh yeah, 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 because I'm Campbell DO land. So when I say Campbell, people go, "Oh, wow." And then I say, "Hey, relax."
um,
So how is that for you?
it was a novel experience of being in the South. I enjoyed it a lot.
Hmm.
The food was great. Became kind of a barbecue snob. The mentors that I worked with were really good. And that was an interesting program. It was pretty trauma heavy and but bread and butter, just orthopedic. There wasn't a lot of microvascular stuff and there wasn't a lot of shoulder stuff. But I had the freedom to seek those things out if I wanted to. They gave me that freedom, and so I went on my way to kind of work with some plastic surgeons and work with a shoulder arthroplasty surgeon, and so all in all, it was an amazing fellowship, and I imagine it's changed a little bit in 10 years, but uh, it was a very valuable experience for me.
Okay. And so what is your thing right now? Like, what is your stick? Like, what do you get the most joy in seeing on the board and saying,
Uh,
"Oh, yes, here we go."
it's really hard to pick just a thing.
Hmm.
Um, I still like fracture care. I enjoy those, and so I had a couple fractures this morning that when they go well, man, that feels good. That feels good. You get that bone lined up on X-ray. It just AFT. I won't cuss, but Anna effing Tomic feels good. That's fulfilling.
Yeah.
And but there's some things where maybe you haven't done this particular surgery before, and you got to do some reading beforehand, and you're kind of anxious getting into it. And this still happens to me. I'm 10 years in, and every once in a while, it's like I've never quite seen this. And I'm like, oh, yeah, let's call friends. Like, hey, what do you think about this? Am I thinking about it the right way? Do my literature review. Hopefully, there's some stuff out there that's written about it. Prepare, get ready, and do the case. And more often than not, when you're prepared and you understand the concepts and the fundamentals, you come out of
There
it
we go.
okay. You come out of it okay, and you're like, cool. I now can do that, and that's a great feeling. So maybe as I get older, 20 years from now, I'm not going to be going after those novel things as much, but I hope I'm still hungry to keep exploring and getting better as a surgeon. But it does seem to happen as guys get older. They don't want to do those things.
No?
It happens. There's some guys as they get older, like, nah, I don't do that anymore.
So, curious, have you ever had to do a tendon transfer?
Oh, sure. Yeah. There's certainly some. There's some of the very complex upper motor nerve lacerations where there's some tendon transfers. For whatever reason, my practice doesn't bring those to me a lot, but there's a classic transfer of moving the one of the extensors of the index finger, the EIP will abbreviate, and transitioning that over to the EPL if the EPL ruptures. So for whatever reason, that's come up a lot recently. I don't know why, but I've had like 3 of those in the last couple months, and then I might not have any for a year or so. So I don't know. But yeah, doing
Where-
some tendon transfers is fun.
Yeah, when have you had to call in a friend?
Well, not to actually necessarily join me in the OR, though it has happened. Maybe it was 6 months ago. I had this really complex elbow fracture that I was trying
Hmm.
to do by myself, and I was just having trouble holding all these little chiblets of bone together. And the scrub tech who was helping me just wasn't quite there for this complex case. And fortunately, the OR was below the office, and I could have like my colleague come in and like, hey, just hold this for me, hold this for me while I try to put it together. Mm. So those times come up, and you can't let your ego or not wanting to ask for help because you don't want to look like you need help.
Hmm.
In the end, the priority is patient care. And because I asked for that help, we got out of the OR that much sooner, and the fracture came together probably that much better. And the patient's going to do that much better because of it, because I was willing to like, please just, I need your hands to hold these bones together for me, please.
The poor scrub tech. Oh my God.
Well, some people don't do orthopedics a lot, and
Okay.
you're asking for things that they may not understand what they are, or they don't understand the difference between a certain size of drill or a certain type of screw. And when you're dealing with a difficult case, you don't want to also be thinking about their job or going to
Right.
their table and taking the stuff off the table. You're trying to deal with this stuff, and those are things that you have to navigate. And being around Jocko, it's helped me deal with those situations better, trying to be a better leader and realize that there are things that I can do better, even though it's their job. I could do my job better to make their job easier. And so yeah, having influences like Jocko around has definitely helped me be a better surgeon, I would like to think.
Okay, well, since you brought it up, we've spent an hour and 40 minutes and I haven't even thought about Jocko. So tell the people, what is Jocko like in real life? Because I feel like I know Jocko personally.
Yeah.
He's helped influence my leadership
You listen to
skills and
500
things.
hours of him and you're like, yeah.
I
Um,
like this guy.
what he is like in the way he projects himself on the podcast or whatever, that's how he is in real life. He's true to that. And I first met him when I was doing MMA. UC San Diego Orthopedic Surgery had a research year. That second year, it was a research year. And so that was the year that I got some more time. Let's get in a fight. And
Let's
so
go.
I ended up at his school and got to know him that way and have known him ever since. And so I've been able to be around him a lot. And he wasn't a big talker. Like, he was clearly a social guy and that kind of stuff. But there was one thing you would notice of, like, if he said something, it was incredibly motivational. And now you're ready to like run through a wall. You just have the right timing, the right cadence, the right tone, and say the right words. And all of a sudden you're
Yeah.
like, let's go. And so you could see there was something there. And I didn't know anything about his military career at the time. I knew he was a SEAL, but okay, all right, San Diego, there's a lot of those running around.
Yeah, of course.
And but over the years, you just you rolled together for 45 minutes, beat each other up, and you're now kind of going over techniques, or, hey, show me that, like, what did you do there? And then you start talking about life and things that are going on. And he always had like solid advice that was like, yeah, that's really good. Make it sound so simple,
Yeah.
And then it was, 2015 or whenever that was, that he started doing his podcast. And I kind of joked like, yeah, you're going to talk for 3 hours at a time. Like, yeah, that's not you. Well, I was wrong.
He talks for
But
so long.
yeah, but he's clearly good at communicating. He is good at writing. He understands how to use words. He's well read, and he does his research. He cares about what he's going to be talking about, and he certainly has a bigger purpose, a bigger meaning. And he's fallen upon something where, even though we're not in the military and we're not looking to fight in Afghanistan or something like that, as doctors, we're finding motivation and ways to be better people and better leaders and work better, because this former Navy SEAL who does jujitsu is able to put his thoughts and ideas out there. So it's pretty cool. And yeah, it's always a good thing to be around the guy. He's a I don't know, genuine person. I'll just leave it at that. Like, what he puts out there, that's who he is.
Right. Yeah, thank you for sharing. And I won't ask for any crazy Jocko stories. Come on, man, did you beat Jocko one time? And then I can post a clip and say, "Oh,
Yeah, yeah,
this is the
yeah.
time he beat Jocko."
No, I can
Um,
say the overall score of him tapping me to me tapping him is a lot to, I don't think I've ever actually tapped him. Positionally, I might win some battles, maybe more often
okay.
than not, more recently, but over the years, starting back in 2009, 2010, or whenever that
Mhm.
was, he racked up the score quite a bit.
Good, good. So he's more of a mentor presence in that gym, I assume.
Yeah, yeah. I mean,
Yeah,
he's got his, he's not, I mean, he's super nice, and anyone who comes up to him, he'll shake their hand, take a picture with him, all that kind of stuff. But um, yeah, I mean, I think anybody who's around him kind of like, hey, that's a good person to look up to, and I agree.
yeah. He's a cool guy. He's had and he has a big influence, obviously, on what we're doing here today. So you really have no idea once you start doing something, the kind of impact with the mindset, the kind of impact it can have to me. But I was curious about if you don't mind sharing maybe any dark, very difficult moments during residency in becoming the doctor that you are today that you might be able to speak to, because I know it's not all smooth sailing all the way through. I know I've had my challenges just in this 4 year thing that I'm doing here that it's changed me for the better. So I'm sure you've got something, at least in residency, or something that you had to overcome that might
Yeah.
help somebody.
Um, yes, residency is a challenge. And it's filled with self-doubt, usually, making mistakes, without a doubt, um, long hours, sacrifices, all these things. Um, and man, there's a lot of lessons. I remember the first time that I thought I'd made a bad mistake, like I missed something. And, there's the thought of like, well, do I just kind of hope it works out, not tell anyone, and he'll come back to clinic. I'm sure he'll come back to clinic, and then they'll deal with it then. Or do you do the right thing, give your attending a heads up, and go, hey man, I messed up. And in the end, that's the decision I made, and it was really hard. You want to be good, you want to not make mistakes, you want to do everything right, and you don't want the attending to think, oh man, you missed such an obvious thing. And in the end, it wasn't a huge thing that I missed. In fact, it was actually not a real thing. It was radiology overcalling something. But my attending, to her credit, Dr. Sandy Schwartz, who has shaped decades of UC San Diego residents, and we're all better off for it, was patient and understanding and took time to explain things. And I learned something. And because of the way she interacted with me, I was never afraid to bring something up to her if I felt there was a problem or if I had made a mistake or something like that. But it was hard. It was so hard to make that call, like pull her away from whatever she was doing late at night. It's 9:30 at night and she's on call, but like, I don't want to have to call her about this. Um, but I did, and it was a good interaction, and it built something better because of it.
So having integrity, I'm assuming that's not the only. I'm not going to cuss either, but moment that you've
Um,
had.
no, let's see. I mean, the first thought that also just flashed my head, but along the lines of integrity, it is so
Yeah,
important. As far as being a team, if people can't trust that you're going to do the right thing, then the team's not going to work. The attending's got to know that you're going to do your best. And if there's a mistake, you own it. You're not going to try to hide it. And if you're going to try to pass the orthopedic boards, you're going to have a case that didn't go the way you want it to go. And if you try to hide that or punt it off or ignore it, you're going to fail the boards. So ownership, as Jocko will label it, is so important. No
yeah,
one is perfect. Own your mistakes, learn your lessons, and make it right the best you can. And try not to let it happen again. So those experiences are just throughout residency. But the funny story that I thought of, that some people might find humorous, I might have been an intern, maybe a second year.
okay,
and I'm stressed. I'm tired. You're getting this page just about the stupidest stuff. Patient's potassium is low, and it's 2:30 in the morning, and you're like, what? Why are we ordering a lab that with the result coming back at this time when,
Telemedicine.
yeah, like, what is going on right now? And and I think I had been with a senior resident with me, and essentially she punted something off onto me, the junior. And I reached my point where like this is brutal. I can't do this right now. I let the doors close as she walked out, and I headbutted the elevator super hard. Like, it shook the whole elevator. But what was really funny is I had forgotten there was someone else in the back of the elevator. I think maybe a nurse or something like that. And so I'm pissed. I just headbutted the doors of the elevator.
Yeah.
And then I kind of turn around from the doors to kind of like pace around the elevator, and I see her there just like, oh my God, oh, what are you doing? Yeah. So you get those moments. It happens. You get to a point. I should have been working on some breathing techniques and not sacrificing my head. But anyone who knows the jokes about orthopedic surgeons and stopping an elevator door, an orthopedic surgeon's not going to put their hand in. They're going to put their head in to stop the elevator door. So
yes, strongest bone.
Yes.
Okay. And so I know we're kind of coming up on the time that we had talked about. So I kind of wanted to see, and thank you for sharing. That's awesome. Like, I'm in the elevator, and I'm in the back. I'm just watching somebody.
Just
psychotic. I don't know.
Smash their head against this door.
Maybe there's blood on their scrubs. I don't know.
Yeah.
But what are you up to these days? Where have you found fulfillment outside of practicing? Like, are you part of a private practice? Do you have other stuff going on? What is kind of the breadth of other things outside of medicine that you find joyful?
So private practice, orthopedic surgery. I do have an academic affiliation with UC San Diego where I take call there. I've changed my practice a little. There's certain with workers' comp, which is a painful thing to deal with. If you just want to be a doctor and help people, and you've got bureaucrats telling you what you can and cannot do, and then you have patients who aren't necessarily incentivized to get better, it's not a fun way to practice. So I'm trying to do that less. So being a little more selective with those sorts of things. This past year, I got an additional board certification in lifestyle medicine. And I'm not entirely sure what I'm going to be doing with it, but I hope to perhaps coach some people on lifestyle changes they can do to become healthier, more effective. I still plan on doing jiu-jitsu, and I will still definitely be around jiu-jitsu. I am the ringside physician for the UFC's Brazilian Jiu-Jitsu competitions. So that is fulfilling.
Noticed, I thought that's sick.
Yeah, so that's been really cool, and that's a story of connections and people I met 20 years ago through the world of jiu-jitsu, and them becoming, into positions where they can bring people they trust on board, and I was fortunate to be someone they thought about, and it makes sense. So, and then I'm proud of myself for taking the time off to do something like that. A few years ago, I might not have been willing to take time away from my practice to bring ringside for this, because you're definitely not doing it for the money.
Really?
So, no.
Okay. UFC, Dana's holding out on you guys.
Well, it's never the expectation to get paid much as a ringside physician. For those of you who are interested in doing that sort of thing, you're not doing that for the money. You're doing it because it's fulfilling. You will care about the fighters. You want to make sure they're as going to be cared for as possible. But yeah, it's been a great experience. It's fun. It's put me in contact with other doctors who aren't orthopedic surgeons who have been doing this kind of stuff for a long time, and there's some stuff I'm learning all the time about how to care for these combat sports athletes to be better at that. So that's been fun. And yeah, just exploring, doing things, trying to write a book. Part
Man,
of
did we have the
my
podcast at the wrong time? We
well,
got to plug your book.
when it's done,
Okay.
we could plug it then. Um, yeah, it's part of the process of I've done some research. Let's put it down on paper, combined with the fact that I've always told myself I'm a terrible writer, and let's not be terrible. Let's prove to myself that I'm not terrible and do something I might be afraid of otherwise doing and get better at it. So, uh, yeah. So
Okay.
the journey continues.
Awesome. I'm sorry, dude. You gotta my curiosity about being a ringside physician at these combat sports events, man. What is that like? I mean, because you said it's a learning process. So what's the learning curve there like?
Um, I mean, there's certain logistics to navigate.
Hmm.
Everything from, okay, the patient or the fighter got hurt. What do you do? To, all right, this is something you need to send to the hospital, or this is something you can just send to the back to the locker room for a half hour and you're going to check on them again, and then organizing that recheck. Um, and then communicating with the paramedics to make sure they're on board with what they're doing. Uh, so there's those kinds of things. And then, I'm an orthopedic surgeon. I'm fine with musculoskeletal injuries, but a guy gets a tooth knocked out, or it's a bad concussion, or an eye injury, or things like that, where it's like, okay, I've got an idea, but what would you do? And then you can learn. And so there's that kind of stuff. And then as a person who's into these sports, it's awesome to be ringside. You got the best seats in the house. You're seeing some of the best people in the world do what they're really good at, and being part of this bigger team that is looking out for these athletes is fulfilling, to say the least. And yeah, it's an honor to be part of it.
So tell me how can our little hand sustain constantly these axial loads onto the carpus or whatever
Yeah, it's
over
clear
and
that
over and over again. I
it's
don't
clear that sometimes
understand.
it can't. Um,
Right.
Broken hands do happen with some
Hmm.
frequency, but it's also testament to how amazing our hands are. These combination of levers and joints and just all of these different things going on in the hand to create something that can play piano or punch someone in the face. It's pretty amazing. Um, I haven't actually listened to the interview yet, but a lot of people have brought it to me recently. But apparently, Elon Musk, during an interview about AI and creating cyborgs or something like that, was talking about the hardest thing is reproducing the hand. And as a hand surgeon, I'd like to think that yeah, it's that complex and difficult.
Yeah.
But it clearly is, and it our hands are how we interact with the world, however that interaction with the world may be. And our brains have evolved along with our hands to do amazing things. If you look at all the different things that humans can do, surgery, grappling, punching, uh, it's pretty amazing. So
Yeah.
hands are great.
I love hands. I when Cadaver Lab, when it was hand time, oh my goodness. My hand was the most intricately dissected hand. I was just like looking at it like this, I will never see. This is the coolest thing ever. And I will get to sit if I go all the way with this. Are you
Yeah,
kidding me? This is gonna be
gentleman
awesome.
surgery. Gentleman
Yes, sir.
surgery. You get to rest, take it easy.
Yeah. You get fractures, you get intricate stuff. It's awesome. What's your favorite surgery on the hand? Classic. What's your favorite color question?
Um,
So
beyond
you
the
said you like the
fracture care,
fractures right now.
I
Yeah.
do like fractures. That's always going to be gratifying when you get those to line up. Uh, you know, something that's interested me that I've kind of been teaching myself since I went into practice 10 years ago is wide awake, local anesthetic, no tourniquet, meaning the patient is wide awake. You're just using selective injections of local anesthetic to do sometimes fairly big surgeries. And it's really cool to do a surgery around a tendon, whether it's that tendon transfer I was talking about from the index finger to the thumb, or a flexor tendon that's been cut, where they're awake, they can't move whatever they want to move. You're interacting with them as you do your surgery, you put things back together, and then you kind of pull their curtain down and go, all right, move. And then they can. And it's pretty awesome.
That's cool. Yeah, because I've seen a trigger thumb or a trigger finger release at bedside. When you said that, I was like, oh yeah, I remember seeing that during a shadow. And this is the craziest thing. I've never, in no other surgery have I seen somebody be fully awake
Yeah.
while the thing that the appendage is getting operated on. It's so, so cool.
It is pretty cool. And those problems around the hand, I mean, it's pretty easy to control their pain with local anesthetic. And yeah, even a trigger finger, it's pretty rare that I do a trigger finger that with anesthesia because it's cool. You see the fingers locked, they can't open it. You do their surgery, all right, make it lock. And now finger moves. Surgery took a few minutes to do. They're happy. You're happy. Hand surgery is the best.
Well, it sounds like I could nerd out with you about hand surgery all day, but
Yeah,
I gotta let you go. I'm so
it's been
sorry.
fun.
So it has been fun, man. Thank you for hopping on and letting me pin you down with a bunch of questions for a couple hours. I appreciate it.
No, it's been good. And as we kind of talked about before we went online, it gave me the opportunity to reflect and think about things and hopefully someone finds it valuable.
Well, everybody, that's Dr. Pomerantz. Hope you guys enjoyed the conversation, and we're gonna hop offline, but I hope you guys got something out of it because I sure did. All right, guys, later.